Hello and welcome to the Healthusiasm podcast, a panel discussion on innovations in health and self-care. My name is not Christoph Schukett, and I am not the author and keynote speaker on Healthusiasm. My name is Nia Escobar-Kölle, and I'm your guest host for today's episode of the Healthusiasm podcast. As an innovator connecting the dots between corporate startups and founders in healthcare, I am deeply passionate about today's topic, not only as a driver of change, but also as a patient, a user, and of course, a woman. And this week, I am back as your guest host and continue to talk about women's health following our special episode in March about International Women's Day. Today, I'm joined by a panel of experts to explore the positive transformations shaping not just health, but yes, you guessed it, women's health, and particularly menopause. And for this discussion, we have some incredible voices in the field. From Scotland, but living near Brighton, medical expert in digital innovation, Dr. Keith Grimes.
Fit like Abdi.
From London, the menopause expert, Dr. Elise Dallas.
Good morning.
And last but not least, from Ghent in Belgium, human experience expert, Zouina.
Hi there.
And as you can hear today, we have quite fitting since we have Elise as our menopause expert. So let's dive in and explore what's happening in menopause, like trends, innovation, and news. And I think it's important that we can set up a general context in terms of what menopause, because menopause is finally getting the attention it deserves, with innovation driving a much needed shift in the conversation in research, diagnostics, and care. And by 2025, so next year, actually, over 1 billion women worldwide will be in menopause. And yet for decades, this phase of life has been underfunded, under-researched, and misunderstood. Every woman in their life will go, is going, or has gone through menopause. So this is a life stage that affects every single person that is alive and going through life. Did you know that the average age of menopause is 51, but actually that the symptoms can start in the 30s and can last anywhere from 1 to 6 years or even 15 years? And that today there are 34 recognized symptoms ranging from hot flashes and insomnia to cognitive decline and increased dementia risk. And despite this, and I include myself in this shocking statistic, over 90% of women are never educated about menopause. So when I was doing research for the podcast, I also learned an incredible amount of information about my body and what's going to happen to me relatively soon. So without further ado, let's dive into the latest innovation shaping the future of menopause. So maybe let's talk about menopause, beginning with the diagnostics. And Elise, you are the expert. We know that wearable tech is enabling early detection of perimenopause, helping women prepare before symptoms appear. So maybe you can share some context with this.
Absolutely, and thank you for having me on this. But the biggest question, like you've alluded to, is that people don't really know when it's happening, how it's happening, and because of the complexity of how people react to menopause, some people can have lots of symptoms so bad that they leave, 10% have to leave work. Some people don't have anything. We're learning more and more about what are the common symptoms. And so I found it really interesting. And the biggest question is that people ask when they're sort of in their mid-40s, like you say, the average age is 51, but the normal menopause can happen between age 45 and age 55. And so therefore, if perimenopausal, which is when your hormones start to fluctuate, and that means instead of going in a nice regular cycle like it's been for your periods each month, it starts to fluctuate. So the early changes that we know of when someone comes to see me, I will first ask about their period, and if there's some slight fluctuations, like there used to be a 28-day cycle and now it's changing within less than 7 days. So, it's like 30 days or it might be coming 26 days. Then I know they're in early perimenopause, not early menopause, early perimenopause, and they might be suffering from other symptoms. And there are lots of other symptoms. There's up to something like 35 symptoms, from physical symptoms, hot flushes, night sweats, vaginal symptoms, aching body as a new one as well that we've just now given it a term, lots of psychological symptoms, new anxiety, rage, biggest one, brain fog, insomnia, and all of these start to very gradually creep in. And so it's really interesting that we can the ring Aura, which collects this biometric data, has partnered with Clue, and to see not only whether they can predict when perimenopause is happening, but also it might provide some solutions. So they're looking at sleep disruptions, heart rate variability, skin temperature, to see if we can see if there are clearer answers to when someone comes to see me. Oh, am I in perimenopause? I can really tell from their symptoms and what they tell me. But it would be really interesting to give that, because knowledge is power, isn't it? And it really empowers someone to think, okay, am I going through it? How can I prepare? I'm prepared for this. And like you just said, not many people know about it, as in what to expect. So it's really good to give that user of the ring or the wearable that they're using every day anyway to track their symptoms, which they're doing already with Clue's tracking and symptom capabilities. So we can just sort of gain more insights into female health. So we can inform early diagnosis and better symptom management potentially. So, but it would be really good to see if they can share that data as well, because they're already wearing it. These aren't clinical studies, as it were. It's kind of like real world data. They've already got lots of members. I think it's 100,000 of Aura members being analysed, of those over 40 to take part in the study. And I think you actually, someone else actually joined in the study. So it's there and it's available. And what's nice about it is that I think that they've already gained the trust of those Aura members, because I think, privacy settings, and I think UK women often worry about data security in health tracking apps with, reasonable reasons from the past. But I think that, it's a bit like natural cycles when they were trying to become an app, which they have now, the first digital app for contraception. They leveraged initially the data that they had, and because they built that trust and community with their users, I think hopefully Aura members will want to take part in this study, because it's looking and aiding women's health research, which we know was very understudied.
Isn't that interesting? It's funny, as you were talking there, Elise, and you mentioned Aura, 3 of us put our hands up to show the Aura rings as well. Now, I suppose we're a sub-selected group here as well. But it's really interesting hearing both you and Nia talk about this. I'm a doctor. I spent a lot of time in clinical practice, and I was fantastically poor at picking up some of these things as well, or not hearing this as well. I think we're all on a journey of learning. The bit that I think is really fascinating, and we may come back onto, is about that kind of data gap, women's representation of the data we have, is how consumer technologies, real world evidence, are starting to correct that as well. It's fascinating that information will be out there. And yeah, when we were thinking about this, I was looking at the Aura Ring, and I know that the latest generations of the Aura Rings will do more in the way of temperature tracking and the like too. So I suppose we've got out there that pool of data that can help filling in those gaps.
Yeah, well, we're already seeing when they pick up, you're kind of cooler in the first half of the cycle, and you warm up after the second half. And so I guess when they're looking at irregularities, like I said, when it starts changing by sort of 7 days, that might indicate that you might be in perimenopause.
Yeah, what I love about your story, Elise, is that we're taking a human interpretation out of the equation, because it's a very complex puzzle.
Yeah.
And I think women in menopause are also facing a lot of kind of preconceived ideas on menopause. And I think if we can have kind of someone doing the work for us, because we get preconceived ideas of what menopause is supposed to be, and we are just discovering, as you see, body aches and things like that, which first would never occur as a specific symptom. So I think putting the human interpretation out of the equation, I think, is a very, very good evolution. And as Keith said, him being a physician also kind of missed listening, hearing, or seeing things. I think that's, from what I hear, I think these preconceived ideas, and also if you go further in some countries, the cultural weight menopause has, if we can objectivize that, I think that would be an incredible way forward.
Yeah, absolutely. And like normalizing it, this is what's going to happen. It's a life stage. It's not a disease, because we've got to remember that I think it's like 1.1 billion women going into menopause in the next few years, and it happens to everyone. You may have an earlier menopause or a premature menopause, it's sort of 1 to 5%, but otherwise everyone is going to go through it, like a bit like puberty, but it affects everyone very differently. You know, we've got women in the height of their careers, they've got families, they've got, you know, we used to die after our menopause 100 years ago, pretty much. We didn't need those extra 30 years. The average age of women is now 83, as opposed to just after our menopause. And so we've got to look at that hormone, estrogen, and obviously progesterone and testosterone, but that drops off, and we're starting to realize how it affects, you know, just not only our symptoms and, you know, going through that transition, as it were, but what happens to the rest of the body. And so it's really important in, you know, in terms of longevity and health span as opposed to lifespan, what we can do in those 30 years to improve our lives.
And I think what I really like about the Aura and Clue study is that we are using biometrics that to really understand women's health. It's not clinical studies in very secluded settings or very controlled settings, but we're really going out there to the women that are living their daily lives, have families, have their jobs, traveling, resting, and we're looking how perimenopause and menopause is affecting their life with data, with also valid data, right? And this is something that, as we talked in the beginning, we don't have a lot of data. It has been understudied. So this is a way also to fill that data gap.
I think this is a nice segue for my Healthusiasm, because I've just discovered a great Healthusiasm about women facing higher lifestyle disease risks. In general, women are healthier. We know they are smarter. We know they are healthier. We know that they take better care of themselves. But if they endure negative effects of negative lifestyles, they are impacted more. So the relative risk of a negative lifestyle is heavier in the balance as for men. So if we look at heart disease or cardiovascular risk, we always define that as a typical masculine disease. And in general, women are cardiovascularly, you know, from a cardiovascular point of view, they are healthier. But if they engage in non-healthy lifestyles, the impact, the price they pay is way higher than for men. So I think, once again, that data and that personalized approach of one size fits no one, I think is very, very important. And to be honest, it's not just a biological issue, it's also a social cultural factor, like stress, healthcare access, or symptoms being ignored could play a very important role too. So I think lifestyle matters for everyone, but for women, the stakes may be even higher. And I think, as we say, it's the project for Aura and with Clue, more research can help us not only vary by race, but by gender, and even menopause status. You know, what is the effect of a negative or a risky lifestyle within menopause? Is that amplified by menopause or not? So I think that's an interesting way of being more precise in the way we calculate risks based not only on gender, but also on which life stage you are into.
Yeah, and of course, women are disproportionately affected by some of those socio-demographic pressures. In any case, I mean, we're hearing what you're saying there, that the impact of lifestyle and environment being greater on that population, and that population is already disadvantaged in terms of being exposed to that to a greater degree, and the way that the world has been set up. So it's interesting, isn't it? We're talking about Oura rings helping surface in an objective way things that people aren't seeing. And then, Alicia, the other thing that I think is really powerful is listening to the subjective public voicing of words. It's such a powerful thing. Brain fog is not a term that came out of a clinical background. It came from a subjective experience that their brain felt foggy. But the thing is, once you have a word that really nicely captures what the experience is, you can start to talk about it. If you can't find a word for it or a series of words, it essentially doesn't exist. You can't communicate that. We see that with the rise of things like GLP-1s and the phrase food noise as well as another thing, a word that captures something that many people experience but never had the words for. Once you have a word for this, that's great. And it wouldn't necessarily come from the clinical establishment, meaning that the clinical side won't be aware of this too. And then research focuses in certain areas. So, as we aware of this gap, we're also seeing solutions arise as well. So, it's not good that there's a gap, but we're seeing optimism there.
Absolutely. And just to point out that it's not cancers that kill women worldwide. Heart disease, going back to your point, Mo, is the biggest killer of women worldwide. In 2011, in the UK, dementia overtook. But again, that's because we're making women live longer. And unfortunately, the health span, the health bit isn't there. So it's about protecting all of our organs as we get older.
Mm-hmm. But Nia, the other thing is, as I was hearing Mo's Healthusiasm, funnily enough, that one of my Healthusiasms comes off the back of that as well, with something called the WHIT platform, which is maybe useful to bring in. So we've been talking there about this gap, and then we start to hone in on the data gap, and that is what Mo was talking about. Well, the WHIT platform is really interesting, something that we'd looked at here. I was made aware of it sort of off the back of a report back January 2025, combination of the World Economic Forum, that august body, and McKinsey Health Institute. And they've been looking at, year on year at this health gap. And so, why are they looking at this? We've already mentioned it, but some numbers: women live 25% more of their lives in poor health than men. And if we could close that, if we could get to a more equitable situation, this would unlock, and here's big numbers, 75 million disability adjusted life years and 1 trillion in annual global GDP. So even if you only just care about that, there is very, very good reason to be doing this. What conditions? We've already mentioned them, ischemic heart disease, cancers, and then globally postpartum hemorrhage, hypertensive disorder. And this is the sort of clinical side, but then we've got the health span, and health span, that period of your life where you're feeling healthy, premenstrual syndrome, menopause, endometriosis, and so on and that. So again, we're talking about a disparity with different impact areas. And in this report, part of this is driven by the lack of knowledge. And so they talked about 5 key actions. And I think there'll be a lot of people nodding along in here sagely too. We start by counting women. I remember listening and reading Carolyn Criado Perez's book about the default male and everything on this, being able to sex disaggregate the data so we actually understand what we're talking about when we're talking about people. So collecting data not only on sex and gender, but also conditions that are otherwise not focused on, like you mentioned, Elise, menopause, menstrual cycles, and so on. And then within that, from that, increasing study in women, providing care and care guidelines for women, including all women from a global perspective. And the WHIT platform itself is part of the solution, a platform to track these important measures. It's not one thing to just say we should do it. They provided this platform in there, looking at all the different aspects of it too, with an aim of achieving that goal of not only letting people, and women in particular, live happier and healthier lives, but along the way unlocking a bunch of money that could be good to good use.
Yeah, women providing care, that's an interesting one. Eh? We know that healthcare thrives on the representation of women in healthcare and caregivers. I think that is also very important. And you were talking about a data gap, Keith. Well, maybe I have a quiz for you. And it's not a nice topic, but the perspective is positive. It's about suicide rates amongst healthcare providers and physicians. So if you look at suicide rates among physicians, there is an incredible gap between the rates of suicide rates amongst men and amongst women. So for men, the suicide rates are 16% lower than the average population amongst physicians, 16%. What would be your estimate of the suicide rates compared to the overall population amongst women, healthcare providers, physicians?
Well, all right. Okay. So I already know that those rates are higher than the general population, and I know which way this is potentially going to go. The question is how much higher? So I'm going to put a figure on this, and I'm going to say 20%.
Elise, what do you think?
I was literally going to say 20%, so I shall say 23%.
Okay, Nia?
I'm going to go higher and say 35%.
Okay, we come from a minus 16 to a plus 47.
Wow.
Minus 16 men, plus 47 women.
Can I ask out of curiosity, is that after the age of 40, like after menopause, or that doesn't give age range? Because
that is the interesting part. That is
We
the
know that
interesting part.
suicide creeps up in women with
Exactly.
menopause and after menopause, and so that is also a health risk.
Well, it's interesting. The article didn't mention the specific, the specific phase in which maybe the suicide rates peaked. But it's really important to see. And there's also not just biological factors, but also social cultural factors. So there's more likely of having hormonal shift and being vulnerable. We know by definition that suicide attempts are higher within women. Suicide success, let's say, is higher amongst men. So that we know depression, mental health, job-related problems, work-life balance, where the responsibilities of having to juggle all these things are very important, but also sexual harassment, for instance, in the healthcare system might affect female physicians, contributing to higher stress and mental challenges. So the big takeaway is, I think it's a very important to know. And once again, here we are, Christophe, Nia, Keith, care for caregivers, where do we stand on that? We are relying a lot on especially the female gender. And I think knowing that the female gender in itself normally has better self-care, we see that there is a disparity for women physicians working in healthcare. So I think that's a very important thing. We need to make sure that we address that and that the system supports healthcare providers in that challenge. So minus 68 plus 47.
Wow.
So do you at least I'm going to come to you. As Mo was speaking there, I started thinking, like, in your experience, the female physicians, healthcare workers coming to you, this is maybe going to sound like, I feel like it's maybe a stupid question, but are they more or less aware of the impact of menopause or not on this? And I'm really interested to know whether they're more proactive or less.
I think, well, I mean, it's so difficult to say what type of person, because they might be suffering from anxiety and depression in the past, and that's where I extrapolate how long has this been going on for. But I think it's very much to do with the type of profession they're in, whether there's flexible working. Like I said, 10% of women leave the workforce in doesn't matter which capacity, but due to menopausal symptoms. And people's often up to 40-50% say it's much harder to work in the workforce. So, and then when we go through menopause, when is that? It's in our 40s and 50s, when we're looking after possibly young children, or they're hitting puberty as we're hitting menopause. and then we've got the sandwich generation, where we might be looking after old elderly parents, and we're the carers for them. And so unless you're in a profession that's allowing your work to be flexible, possibly. And then you've got your relationships. I see a lot of people with relationship issues, particularly around menopause. And that's why it'd be interesting to know whether they, what the age of these women were. It's, lots of potentially sexual difficulties, relationship difficulties, brain fog when you're trying to present. There are all these symptoms that will affect you as a woman. And I think, it's still, even though we've been talking about it a lot, it's still such a taboo that people don't talk about it. And certainly, I personally think that the women that come to see me that are within the medical profession, it is very much secret. It's like they haven't left work yet. I'm running this service, or I'm doing this. I have to stay professional, but I'm absolutely losing my mind. I had someone the other day. She's a surgeon. And she was giving, she couldn't remember the instrument that she was asking for in the middle of an operation. She was she wasn't. She was kind of early 40s, and like I say, she was like, "Is this menopause? Is this brain fog?" And sometimes it's a bit difficult to extrapolate. Yeah. Is it because I've got young kids that have kept me up in the night? They are often, unfortunately, we've all fought for women's rights, and that's fantastic. But there's that old saying: "Is can we have it all at the same time?" And I think, yes, we can have it all, but potentially we need to make it flexible so women can have it all with that flexibility, because expecting women to, take up the household chores, the relationship, the career, looking after the elders, the youngest, it's too much. And then they've got to, like, you said, yes, women might be good at self-care, but I don't know any mother or professional woman that doesn't put her self-care at the bottom of that list. It's always, let me do the kids first, let me do my profession first. And then often, and this is where lifestyle and everything is a really big part of what we now need start prioritizing is their exercise, their nutrition. I just had someone yesterday. Again, she's a nurse. She's like, "What do you eat?" Well, I just eat what's left off the kids' plates. They will be at the bottom, even though they might prioritize. I think millennials are much better at prioritizing self-care definitely from what I've seen, and whether that's to do with wearables or tracking devices or just being way more engaged, or this whole mental health, wave of recognizing it, possibly post-COVID, I don't know, but I can definitely see a difference in millennials, sort of Gen X, of them tracking, being more aware of when their periods are, for example. They'll bring out, "Oh, when do you want to know exact date? Oh, I've got an app. I'll tell you exactly." Whereas, someone my age is like, "I don't know, like, oh God, let me think. What was I doing at the time?" They're much more in tune with their own bodies. They're much more interested, and they are much more confident, I would say. I think, in saying, actually, do you know what? That's not right for me. I'm going to put up some boundaries and I'm going to self-care. Whereas I think Gen X women are generally, yes, people please, that will take on everything, and they have to relearn, actually, I'm going to put up these boundaries and say, no more, I can't do it. This is where I've got to stop.
Nia, you had a remark?
Yeah, I just wanted to say that, I'm a millennial, I'm 35. And what I was thinking, what you were saying, Elise, is I have all the apps, right? I have the Oura Ring, I'm tracking my period, I'm tracking my physical health, I'm very active, I'm drinking water, blah, 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 tracking my sleep, trying to hack everything, right? But what came to my attention is that even though I have the data at hand, and I've had the data of the last 5 years at least, actively, because I have the Oura Ring and have a Garmin watch and so on, I still doubt myself a lot, and I still doubt the data. And I think this goes to a wider, let's say, systemic belief of women gaslighting themselves with their own health, right? So even though, yes, we might be empowered as millennials, in general, women, it's like, oh, if you have a very painful period, this might be endometriosis, but no, but it's okay. It's not that painful, right? Or it doesn't happen that often. And if your sleep is off, it's like, oh, well, you have children, but it's not that severe. I still can function, or I should function. So even though there might be data and, like, let's say the mentality is there, it's the lack of education. We do not talk about menopause. We do not talk about women's health cycle overall, and reproductive health ever. And even I went to a women's school, only a girls' school, and we didn't talk about that. And now it's still not covered. There's no place where you can go and like find the information. Either you basically start looking to this when people around you have it, when your parents are going through this, or your friends, or yourself. And even so, you still doubt yourself. So it's a very tricky situation of when and how do we get educated, and when do we actually seek help?
Yeah, maybe an interesting acronym there. I think we need to lift the fog of menopause, and fog is an acronym for fear, obligation, and guilt, which often is related to how social culturally menopause is positioned and also framed. I think I'm looking at the time. I think we have maybe some time left to go into what are the perspectives forward to menopause. I think we've been really, really good at, creating the burning platform. I think everyone is aware that there needs to be something but what is the way forward? What are perspectives we see into moving forward in that menopause?
Yeah. Well, there appears to be sort of plenty of digital health applications and platforms out there. I think just briefly to sort of ground it, whatever solutions are out there, because you're right, we've sort of laid out a lot of the problems, and there's that growing awareness. And Nia, you're a millennial. I'm a Gen X. Elise, you're a Gen X as well, I think. Mo, where are you? You're obviously young. You're Gen Z, aren't you?
I'm Jurassic Park.
Jurassic Park. There was within all of this as well, there's that sort of feel that, depending on what age you are, you engage with things. And actually there was another piece of research that came in, this time from Rock Health, about, they describe it as screenagers. Here we go. Christoph, not Nia Christoph, loves the new words, but yeah, screenagers, those that are sort of raised all the way through to silver surfers, how each generation clicks with care. So if we're thinking about some of the solutions of this, it's important to understand what different generational attitudes are to that. So it's a really interesting report laying out in some detail all the different generations, all the way from Gen Z up to the silent generation, I suppose, beyond the baby boomers. And whilst there's detail in this report, I suppose it kind of sort of boils down to two things. Number one, younger generations engage more with digital health technologies. I don't think people are going to be terribly surprised by that. But to that extent, they were looking at Gen Z and using virtual care in the past month, 60% versus 41% in the older generations. Tracking metrics, 64% in Gen Z versus 35% in the silent generation, 39% in baby boomers. And then owning or wearing a connected device. Again, big difference, 60% in the Gen Z, 32% the silent generation. Oddly enough, the millennials, were slightly higher than those two numbers as well. So described as digital devotees in this as well. So that's interesting. We're seeing a sort of rise in this, and therefore maybe we're going to see digital approaches to this being very effective. But what is also interesting is those younger generations, Generation Z, the millennials, less willing to share data with a healthcare provider. Gen Z, 42% versus 90% willingness in those silent generations. They're less willing to share it. Also, less trusting in information provided by official sources. 46% in Gen Z, 44% in millennials, up to 76% in the silent generation as well. So, the healthcare professionals in the room are going, oh, crikey, what's going on here? This is a wee bit worrying. But I suppose it does reflect what we're seeing here as well. What do I think this all means? Well, people are turning to the solutions themselves, and Nia, you've described that sort of uncertainty about whether you can trust even that data you've collected yourself. But I suppose as we go into the solutions, we have to bear this in mind. Maybe, if we get great solutions, but they're not going to be picked up by everyone. I don't know. What do you all think?
Well, I think there are solutions that are also kind of inhibited. There's a lot of controversy about HRT, right? A lot of myths. I think the first myth, and I need to do a shout out to two women I reached out to before this podcast, which are Elise Dallas, who has written a lot of books on menopause, and Dr. Elise Dallas. The first one is, as you said, Elise, menopause symptoms need to go beyond hot flashes. You already addressed that. But then the bioidentical hormone taboo needs to go. I think that was one of the things. Many still believe that bioidentical hormones are unsafe or controversial. These species also said that they're really good for you, for your heart health, as we did, but also for osteoporosis. I think that's very important. And secondly, what Dr. Elise Dallas says, which is kind of an influencing voice here in Belgium, is that don't wait until the symptoms become unbearable. That's what you said, Nia, right? I'll wait a little bit. I'll wait it out. Maybe it's not that, and things like that. Because the best moment to treat is in early perimenopause. That's her experience, is to start there. So I think there's already value in things that already exist, but there seems to be, I don't know, an inertia in an inclarity on the data, and also kind of, I know there was a study a few years ago that was not interpreted well, and that began to run its own life on bioidentical hormones. I think there's value already existing, which we are not leveraging in the ideal way, at least.
Yeah. So, I mean, if we split out, if we look at menopausal management, I kind of look at it in two ways. One is to manage the symptoms potentially, but like I said, we've got this other 30 years. So it's also about looking at your longevity and whether you want to take something that helps that. And then it goes into hormonal or non-hormonal. So if we're looking at hormones, like you just said, we used to dish out a hormonal therapy in the 60s, 70s, and then this big study came 2022, so 22 years ago, stating that, I remember I was at medical school, my mother was on HRT, and it said breast cancer, HRT causes breast cancer, and I remember literally her throwing it in the bin, and that was it, never again. And it's taken us, and I was certainly part of that cohort. I'm sure you were, Keith, as well.
Where absolutely.
A menopausal woman walked in. I was like, oh, God, I don't know what to do with her. I literally don't know what to do. I was not going to prescribe HRT. Anyway, in the last few years, this is brilliant, and it's turned around, and almost their pendulum has swung in the other direction, where it's like, I've got a bit of FOMO, I'm not on HRT. And I think we've got, it's not an either or, and it's very much an individualized conversation according to your risks. And when you talk about bioidentical, I think that's where it's the terminology. So we use, these studies are based on synthetic, much higher doses of
Exactly.
hormones, and a very different cohort. The average age was 63, which is not when we would start. Lots of different comorbidities. So, and it's, it's been a bit disproved, and like you just said, they've reanalyzed the data. So nowadays what we offer is body identical, but we are, I'm part of the, the cohort that will of doctors that will offer regulated body identical. So, and this is part of the, the British Menopause Society, the American guidelines, all the guidelines worldwide, say that body identical. Bioidentical is often a term used by marketing from years ago, when possibly body identical wasn't available so much. And it is body identical still, but they were unregulated, as in, let's take some saliva, let's get your exact percentages of what you need. And so there are lots of, and I'm not saying, all bioidentical is bad at all, but it is not regulated. And so therefore you must be going through a good provider. And body identical, bioidentical is essentially the same as body identical, just not regulated. In America, I think the term just means anything, body identical. So that's where the terminology again gets confused. But as long as you're taking body identical regulated, then I'm okay with it. And also, from a bioidentical, a good provider that has got, good reputation. But essentially, it's a very different type of HRT that we give. The estrogen is body identical. It often goes through the skin. We can offer it orally, but, to avoid certain risks like clots now. And we've got a body identical progesterone as well, and a body identical testosterone. That's not to say that all synthetic HRT is bad at all. It's very much, has its place, and it helps with, bleeding problems. So, for example, the Mirena coil has it can be part of your HRT, the progesterone, and that's not body identical, but it's deemed almost as safe as, or just has a slight risk. But that's the hormonal treatment.
Okay,
and then
Elise, I'm just going to interrupt you for a while, because I saw Nia.
I think Nia's beginning to animate in the corner.
And we're going to take time into, I think we need another episode on this. Anyway.
I was thinking exactly this, because it's so interesting. And I have to admit also, I have not heard of the terms and artificial hormones. And of course, I'm also very excited, and my eyes are just completely open listening to you, at least. And I think I'll also have a homework now after recording this conversation with you. I'm continuing my education as a woman. But Keith, I think you also had a really interesting point.
Well, yeah. Well, there's two things. Like, when Elise is talking, so I've been a doctor for 30 years, and and when Elise was talking about that trial and that, I really remember the trial coming out, and then a stream of women coming in, and basically everything just being stopped. So I've seen all this. But it's interesting you talk about synthetics. It's just a little fact. I remember, and at least you'll know this, there used to be, maybe there still is, HRT called Premarin in the UK. Premarin. Now, the reason I mention this is that Premarin, the name, is a contraction of where it comes from. Pregnant mare urine. Of course, it was harvested from the urine of pregnant female horses. And so, we came from this point where now that's not body identical. It's not synthetic in some regards. You may have issues about how this is obtained, but, imagine this, like I'm saying, imagine in my lifetime, well, 30 years, it's quite a long time, but, we've really, really come a long way. But isn't it interesting that, how do we communicate this simply to people? Because it can get very complex for clinicians too.
I think there's also a next level. You talked about bioidentical versus body identical. I think we can go to the ultimate level of body identical, which is ovarian rejuvenation, where you do that in complement with your HRT. I don't know if you're familiar with the term ovarian rejuvenation. And I need to kudo again a woman, which is Dr. Anita van Domselaar, which is our clinical lead at Relief Clinic. As you know, maybe I'm a part of that. Why? Because I believe in that regenerative approach, where we rely less on medication, less on things that are not part of the body, and we try to stimulate and vector whatever is existing in your body to kind of give a boost in a focused way. So what we do basically is we apply regenerative medicine techniques for women with premature ovarian failure. For instance, they're also known as early menopause sometimes. And many women experiencing POF are told that they have no options other than HRT. For those who want to still get pregnant, do IVF with donor eggs. And I think what we've developed in the clinic is a kind of a complementary approach. It's not one way or the other way. And we work with gynecologists, but what we're really good at is extracting a regenerative part of your body and presenting it again to the ovaries and the uterus. We kind of flood both sections with regenerative material. And we do that under ultra-precise guided injections. And we do that because we take things from your body and present it in an optimized way again to your body. So I think in terms of side effects, long-term side effects, it's really different. It's not PRP. We do something a little bit different. We create ultra high concentration. So I think when you do regenerative medicine, you need to know exactly how much volume you take, how hard you concentrate it, which part of the regenerative material you also represent to it. It can be exosome, it can be growth factor, it could also be little white blood cells. But anyway, for whom is that? That's for women with a fertility goal, for instance, but also women going through menopause. By improving that ovarian function, may help alleviate these symptoms like hot flashes, fatigue, we know, and so on. But also women looking for a gentler transition into menopause. It's not just saying, I don't want menopause, but I think sometimes menopause can really be brutal. And if you want to ease into menopause, that's also how we apply it. So it's not just that regenerative thing. It's one piece of the puzzle. We look at nutritional status and needs, right, to support ovarian function. We look at lifestyle factors, but we also look at hormonal balance. What can we do to optimize it before we do the treatment? So that's what we call preparing the soil. So I think we don't exclude HRT with that, but we kind of support that in a way that is the ultimate body identical approach. And for us, that's, we've had incredible results with it. And I think these struggles, we can alleviate it, we can intercept them, but we can also ease into it. I don't think the idea when we prepare it is to say, I don't want to be in menopause, but let's make it a little bit smoother so it doesn't have that incredible impact on my life.
No, that's so interesting. But that's still a hormonal method, isn't it? And so I was just going to bring in the other, I guess, non-hormonal methods and the newer innovations that are quite interesting to see, because some people either don't want to take hormones or they cannot take hormone, and potentially they've had breast cancer or a hormonal receptive cancer. And so when I was doing this research, it's really interesting, yes, hot flushes aren't. So this is about treating the symptoms, because like I said, you kind of put management into two categories: one, treating the symptoms, but also thinking of my longevity as well, or, cardiovascular, brain, bone health. But in terms of symptoms, there are lots of new tech on innovations for relief. For example, Amira's Terra system, that is a wristband that detects flushes and cools your mattress, or Grace's bracelet, a cooling device for instant relief. There are lots of, even femography. Did you know that could be a healthusiasm? Do you know what?
No, come on. Here
What
you go.
is
You can't just say femography.
Femography, yeah. I can't even say it right. Femography. What is it? Guess.
Now it's F-E-M or T-H?
F-E-M-O-graphy. G-H.
Femography. Well, it's not just photos of women. It must be femography.
Like mapping women's health, creating like a holistic picture of women's health of a woman. Yeah. Okay.
Maybe it's kind of drafting the trajectory of how you will evolve through different phases. No?
If I give you a clue, it's an actual product, physical product you can touch.
Femograph.
No, I think you know.
Okay, it's a type of, basically it's clothing with built-in cooling pouches. So it's for those that are having hot flashes, and it's a whole sort of clothing wear. So there are just new innovations coming out to deal with just those hot flashes. There's also a new drug called fezolinetant, which is a non-hormonal treatment for hot flashes and night sweats. It works in the brain. and it switches off hot flushes. But you've got to remember, these are very much only controlling that symptom. They won't do other symptoms. But by doing that, you can often help with the insomnia. But it won't be helping the long-term life, because we know that HRT can have a good impact on long-term health. And so obviously you've got to have those lifestyle interventions too. So I just thought they were quite interesting.
Elise, you had a special word also that you wanted us to guess.
Yes, I do. Does anyone, I thought I could get away with my filmography, but does anyone know what meno washing is? And that's actually a good time to bring in this, because this is where
Meno washing.
Washing.
Can I have a stab at it?
You go first, Mo.
I think it's maybe brands taking advantage of the menopause to sell things. It's like greenwashing or eco washing or ethics washing. Menopause is a new hype, and we'll sell everything within the context of menopause, but it doesn't really add to it. That's
gold star. Prize goes to you, Mo. Yes, it's exactly that, and that's exactly what we've got to be careful of. Although all of the awareness, and it's great, all of this noise going on about menopause, but I mean, I've seen menopause vitamins, menopause food, menopause clothing, but maybe not have that backing, and they've just put menopause and then charged double. So yes, that's exactly it. Exaggerates, this kind of fear-based marketing to sell unnecessary products.
Do you know
I think
what?
we've got to be really careful of that.
Yeah, it's funny coming into this. Of course, if you've listened to the podcast before, we talk about Healthusiasms and things that we've seen generally. And I know we're talking around menopause here today. So I'm about to meno wash my Healthusiasm, but with good reason as well, because we're sort of talking about all these different areas. And I'd been much taken by a study that came out about the impact of coffee on health span. I will justify this meno washing in a moment, but I think people quite like caffeine, and a big study came out looking at a lot of research that illustrated that caffeine actually does have quite profound benefits on health and longevity. Looking at this, increasing health span on average by 1.8 years. So this is not adding years to your life, but life to your years as well. And then the study itself, which was in Aging Research Reviews, about the impact of coffee intake on human aging. The reason I think it's worthwhile bringing in here is that, when menopause, caffeine can adversely affect the symptoms of menopause. This is true. It can increase anxiety and agitation. It can increase hot flushes. It can even impact urinary function as well, bladder instability and the like. So, I'd actually traditionally gone into this thinking that this is something that people maybe move away from. And of course, it's very, very personal. But this study was really interesting because it actually talked a lot about how caffeine intake can reduce the risk of high blood pressure, ischemic heart disease, stroke, diabetes, metabolic syndrome, obesity, improves mental function, muscular function, immune system function, decreasing inflammation. Of course, all of these things that we're seeing as hallmarks that might be driven by menopause as well. So it's really kind of fascinating. Even within that, coffee contains lignans, which are phytoestrogens as well. Remember phytoestrogens from in the past too. So I just want to add into the mix, as I meno-wash my coffee story, that it's also not as clear. I mean, Elise, I remember telling patients to stop drinking coffee. Just saying that now, but I think it's maybe more complex than that.
The torture. So looking at time, I think we need to slowly wrap it up. It was an incredible conversation, from wearable tracking to early signs of perimenopause to the importance of hormonal and non-hormonal treatments to addressing the data gap. And please don't take away your coffee, Keith. That sounds horrible.
Oh, no. You can have your coffee. Don't worry about it.
Very good. But I think we've all highlighted the need for proactive care starting perimenopause. And we need to work also on educating women, educating clinicians, and pushing to close that data gap that we all see. I want to give you a big thank you to all of you. And before we close the episode, of course, we're going to move into our unusual Healthusiasm. So at least you already opened up a little bit with some of your words, but I also have some for you. So Mo, I have one. So Pvolve is a company in which Jennifer Aniston has invested in. Pvolve stands for personal evolution, and it is known for having a very particular method for something. What is it for? What do you think it is?
Personal evolution.
Mm-hmm.
Jennifer Aniston.
Correct. And this is science fact, by the way.
Well, it won't be right, but I think personal evolution, I think you're healthier and you evolve better if you're surrounded by friends. because
Oh, dearie me.
Aw. We do know that social component is a very important indicator for longevity. So P-Evolve is actually a fitness company and known for its low impact science-backed workouts. And they actually have focused on designing these exercises for women's bodies at different life stages. So, I mean, the idea is that many workouts are just nowadays not designed for things like menopause, pelvic health, recovery after pregnancy. And when women go through these unique changes, most of these fitness programs out there just do not take that into account. And P-Volve is changing by bringing medical expertise into fitness. They actually brought Dr. Jessica Shepard as the head of medical affairs, and they focus on science-backed workouts. From Dr. Shepard, for example, she is an OB-GYN and she's an expert in women's health, and she will shape programs focused on menopause, pelvic floor health, and recovery so that fitness actually can fit into women's needs instead of the other way around. So it's more than exercise, it's a new approach to women's health.
it's functional fitness.
Yeah, exactly. I
Mhm.
was going to say, because
Yeah.
I wrote an article on this. It's interesting because obviously it's quite expensive, and I don't want I don't want women to go away thinking, oh, I've got to get this particular exercise, because obviously Pilates, certainly types of reformer Pilates, and it's basically involving bone strength exercises without putting too much impact on the joints, and also doing balance and stability to help reduce that fracture risk for osteoporosis when you're older. So yeah, it combines a lot of it, but tailoring it to the woman.
Keith, I have one for you. And this is a little bit harder to guess, I guess. What do you think when I say the words menopause in Maiolica?
Say again?
Maiolica.
Maiolica.
And I can give you a tip. So Maiolica is a ceramic style from Italian Renaissance from around 500 years ago.
Oh, all right. Okay. Well, I may be. Here we go. Okay. So this is going to be a wild start. So menopause and Maiolica. Okay. Menopause style. The only thing that I can think is that it is studying how Renaissance era Italy depicted the menopausal person as well. So I think it might be related to that. It's like a medical historical study on attitudes towards menopause, as in how women were depicted in these old paintings. There you go. That's my bet.
It's pretty close, actually. Amazing. So second gold start of the podcast today for you. So we actually forget that women also 500 years ago were going through menopause. And Elise mentioned that it was also a cause of death. But we basically have an artist. Her name is Catherine Moy, and she's using ceramic to tell a story about menopause. So she's basically she takes this large, beautifully decorated ceramic or pharmacy jars in the Maiolica style from Italian Renaissance. And the vases actually reflect the realities of menopause and her own struggles, her empowerment that we can reflect on today. And one of her vases, it's really beautiful. I would absolutely encourage all of you to look for it. It's called Cerebrum Nebula, or Brain Fog, very fitting, which is actually being exhibited at the Vienna Museum in London. She also has other vases called Insomnia, In Praise of HRT, Do Not Shun the Acorn. So she's clearly mixing humor, history, personal experience to show that menopause is not a secret. It's a part of life, and it is beautiful.
I've just got the picture up here right now. It is actually.
Right?
Oh, yeah. Oh, fascinating.
And one, just for the listeners, there's one beautiful vase that is blue, and it has some snakes coming around from the top of the vase, and it has like this different like labels sort of in Victorian style, or I don't know, Renaissance style, sorry, with different activities or thoughts that the artist had. At least I've got one for you. Maybe you know this actually. So Six Senses is a brand known for luxury wellness resorts, but now they're going beyond spa treatments and relaxation. What do you think they're doing?
I think they would start to be doing almost like a health screening, possibly to pick up, maybe blood tests, sort of almost crossing over that wellness into preventative healthcare. So possibly doing some blood tests, some heart tests, and maybe a DEXA scan or bone test, and then giving you a very personal kind of workout and plan, including lifestyle, possibly with medical intervention.
You guys are on fire. Yes, it's pretty close, actually. Another golden star. So Six Senses is introducing a new wellness program, or wellness programs, actually, designed specifically for women's hormonal health. And they're using science, ancient practices, and a holistic approach to help women feel better at every stage of life. So they offer personalized wellness plans that focus on hormone balance, personalized treatments like acupuncture, movement therapy, and nutrition, stress management techniques to support emotional well-being, and a focus on natural ways to improve sleep, energy, and overall health.
I don't know about you, but I immediately started thinking about the White Lotus. So hopefully it's maybe a bit less stressful than that.
Exactly. Hopefully we all stay alive.
Exactly.
No spoilers.
Exactly. And I think with this, we can wrap up the episode. Thank you all very much for your healthusiasms in menopause and women's health. It is a healthusiasm world indeed. So many positive changes are making women's healthier and happier lives every day. Thank you for listening. If you like this show, visit healthusiasm.com to discover more episodes. And for now, I'd like to thank our panelists for their healthusiasm. Thank you, Dr. Keith Grimes, Dr. Elise Dallas, and Zouina. My name is Nia Escobar-Kölle. We were your panel at the Healthusiasm today, and would love to see you again next week for some more Healthusiasm. Ciao!